A group of parents are suing New York on behalf of students. In this program, you'll find out who and why. The flu is hitting young adults hard this year, and I'll be joined by a medical doctor to discuss this. Thinking about dating online? Listen to what Sherry Logan has to say, and Yolanda Watson has an affirmation sent by someone who watches Brooklyn45. And Sharon Rose will be chatting with a young academic achiever about her stellar performance at Medgar Evers College Preparatory School. Welcome to Brooklyn45. I'm Sam Taitt. New Yorkers for Students' Educational Rights versus the state of New York. Sounds like a lawsuit to me. Mr. Michael Rebel, you're an attorney who successfully litigated the Campaign for Fiscal Equity versus the state of New York. Mr. Rebel, what is this lawsuit all about?
Well, the current lawsuit that we just filed about 10 days ago is an attempt to get justice for the million students in the New York City school system and the 2 million throughout the state who were promised and entitled by the prior lawsuit, the Campaign for Fiscal Equity, to billions of dollars in extra funding from the state of New York, and the state of New York has not come through. They've welched on their obligations, and we've tried to deal with them politically. We've tried to deal with them reasonably. The governor appointed me to a commission that I thought would be able to deal with this problem. He hasn't done enough. The commission did nothing, so we're back in court.
Where do you think you are going with this? How soon you think you can get the kind of results that you anticipate?
Well, I do have to admit that the Campaign for Fiscal Equity case took us about 13 years from start to finish. I don't expect this new case to take that long. And the reason why, Sam, is that the Campaign for Fiscal Equity case established a really important constitutional precedent. And that's what we have to build on in the new case. Many people are not aware of this, but we had the highest court in the state declare in no uncertain terms that every child in the state of New York has a constitutional right to the opportunity for a sound basic education, and the state has to make sure there are sufficient resources for that. Our biggest battle in that case was defining what is a sound basic education. The state wanted to make it a very minimal level of education, really 6th to 8th grade functioning. We argued, this was when the new Regent standards were coming into effect, that the constitutional right must be tied to really 11th and 12th grade high-level functioning, and we won on that. So the court said, to give you a more concrete definition, every kid in the state is entitled to a meaningful high school level education that provides them the skills to be capable citizens and productive workers when they graduate from school. So that is a substantial obligation on the part of the state when you compare it to the low graduation rates we have and the fact that the majority of our graduates these days are not considered college and career ready, which is the new term of art in this field.
Sure.
Now, when the dust settled in CFE, and the court ordered the state to determine how many dollars do you actually need to provide this kind of sound basic education. And we went through a lot of extra legal exercises and appeals and all about what the amount would be. But in 2007, the state legislature committed to increase funding for New York City schools by $5 billion over a 4-year phase-in period, and for the rest of the state, for high-need districts in the rest of the state, by $4 billion. So that was quite a price tag. And the fact is that starting in 2007-08, they began the 4-year phase-in. They paid out the first 2 years' worth of money. Then the recession hit. And when the recession hit, first they froze any further increases, and then they started cutting heavily. So right now we're in a situation where in the core operating funds, The state basically owes about $4 billion on this amount that it committed to, and New York City's share of that is about $1.8 billion. So that's why we're going back to court.
Now, you're representing parents.
Yes.
Tell us a bit about these parents and their concerns clearly about their children's education.
Oh, certainly. The individual parents we have in this case are 15 parents from all parts of the state. 7 are from New York City and 8 from every different part of the state. We also have a number of local parent groups, advocacy groups, and we have the major statewide organizations. Among our plaintiffs, we have the State School Boards Association, the State Superintendents Association, the State Parents Teachers Association, the State Business Managers. So we've got quite a lineup, and all of these people are just frustrated after years of wringing their hands, of having to make do with inadequate budgets, increased pressures for Common Core and new teacher evaluations with less money. So that's why we've assembled quite a powerful group. And, you know, I'll say one other thing. It does take a long time to litigate these cases, but litigation can't be seen in the abstract. It's part of the political process.
You attorneys say that all the time.
Well, it's the truth.
Yes.
And
no doubt.
No doubt. And one of the reasons we filed the case in February is we want to have an impact on the current legislative session. The governor proposed what he calls increases. I say it's a reduction in the cuts that would make a difference of about $300 million next year in this core operating aid. It's better than further cutting. But when you owe almost $4 billion, to give another $300 million or so is not enough. So we're hoping that just by filing the suit, the legislature is going to get the message that they better come up with a lot more right away, and they better get back on track with what's owed to our city and our state's kids.
As an attorney, you are mostly concerned with the persons you are representing.
Right.
What about the impact of this on our low graduation rates and on student performance? What discussions have you had with parents and with teachers if they are showing and voicing their concerns about this?
We've had many discussions, and before preparing this suit, the research we did in-depth analyses and interviews in 33 schools throughout the state. There were about 11 of them in New York City, and we examined very closely exactly what programs the children were getting, what the class sizes were, whether they're getting the hours of instruction that are required by state law and by the state constitution. These were the high-need schools. We did visit the schools that had the students who had the greatest distance to travel to get to that level. But they're the ones who should be getting the best resources, and they're getting the worst. So this
lawsuit is an attempt to correct some of that as well?
Yes.
Do you have the support of the teachers' unions? I haven't heard you mention them.
We do have the support of the teachers' union. They're not directly part of the suit, and we didn't have them as parts of the suit last time because, quite frankly, in the political realm, if the teachers are bringing the lawsuit, the governor and the powers that be are going to say this is self-interested, they want more jobs, they want more money. So last time Randy Weingarten, who was then the head of the UFT, was one of our major witnesses. She was very supportive. I fully expect the unions will be supportive here. But we wanted to make a clear message. This case is on behalf of the kids. It's not jobs for teachers. More teachers may get jobs if we need them, but that's not what we're seeking.
I'm actually getting my wrap-up, but there's a lot of information I understand that's available on
www.nicer.org.
That again is
www.nicer.org.
And you can also get information, I understand, on Facebook and Twitter.
Yes.
I want to thank you, Mr. Michael Rebel. You've got a huge task ahead of you.
Well, it's a huge task, but it's a critical issue. So anything we can do for our students, we will try to.
Thank you. And now let's go to Shari Logan.
Are you looking for love in the world of online dating, but you don't know what to do? Well, one writer from the news and lifestyle website, Loop21.com, offers these tips. On your dating site of choice, don't post photos of yourself in your younger years. Doing so will only cause heartache when you show up to your date looking nothing like the person in your profile picture. And worst of all, that little white lie may not lead to a second date. Also, don't lie about your height. There are plenty of men and women out there looking for love in all heights, shapes, and sizes. To be on the safe side, do tell a friend about your date night plans and exchange their phone numbers if possible. And if you're still on the fence about online dating, know that the Pew Research Center's new report says that 5% of Americans who are currently married or in a long-term partnership met their partner online. If you want to know more, send an email to info@Brooklyn45.com or post your question on our Facebook page. I'm Shari Logan. Back to you, Sam.
Reports from the Centers for Disease Control say that the flu is hitting young adults hard. In fact, harder this year than in previous years. Joining me to discuss this is Dr. Vincent Hutchinson. Welcome to Brooklyn 45.
Thank you. Pleasure to be here.
Is this report surprising at all to you?
It is surprising in that in previous years, that age group is usually third in terms of frequency of flu symptoms. The worst group is the over the 65 age group, as well as children under 5 years old. So this is surprising.
What's responsible for that, you think?
It's difficult to say. However, we do know that this age group is generally the age group that doesn't get flu vaccines. The vaccine flu rate for this age group is only about 1/3 or 30%. Young people seem to think they're invincible and that the flu is a mild disease. So I think this is one of the reasons why we're seeing a much higher number of cases in this age group.
I was watching a PowerPoint presentation that you prepared, and there was a section called Flu Basics, and I'd like you to talk about some of those basics. What causes the flu?
The flu is a viral illness. It's seasonal. It's associated with the colder months of the year. In this part of the country, it's generally between October and May. However, the peak months are December to March, with January and February being the worst 2 months of the year.
And we've had a long winter.
It has been a long winter, yeah. And this winter season, in terms of the flu, has been the worst since the pandemic in 2009.
What are the symptoms of the flu? Some people suddenly wake up one morning and they go to the doctor and they say, I've got the flu, or they have a fever. What are the symptoms? How do you know it is the
symptoms
flu?
vary considerably, from very, very mild cold symptoms to severe symptoms like threatening symptoms. For example, patients get a fever, they get a runny nose, cough, and cold. When it gets more severe, they get severe body aches, pains, sore throat, headaches. And this interferes with people's ability to work. People can't go to work. Children miss time from school. Actually, young children under the age of 2 and people over 65 tend to have more serious symptoms. Young children get vomiting and diarrhea, which can lead to dehydration. Older people, because of the waning immune systems, tend to get pneumonias, which potentially can cause death.
Now, we know that kids are in school. We know adults are at work. What do we have to fear in terms of transmitting this or catching it from somebody?
Well, one of the characteristics of the flu virus is very transmissible. It's easy to transmit it from person to person. This can be from direct contact. It can be from droplets that you dispel during coughing or sneezing. Even talking to someone within 6 feet of you can cause the virus to be transmitted from person to a person.
6 feet.
6 feet. 6 feet.
Now, we talked about the symptoms a little earlier, but what are the medicines that are usually recognized for situations such as the flu?
Well, generally speaking, since the symptoms tends to be very mild in most people, then the treatment is bed rest, fluids, stay home. Okay, in patients with more severe symptoms, then you have to go to medications. Now, before we come to medications, I always say that prevention is the best cure. So I always stress that to get the vaccine. The vaccine is the best way to prevent these symptoms from having. There are only 2 medications available now for treatment of the flu. one called Tamiflu, which is for children 2 years and above, 2 weeks and above, and which is given by mouth, and nasals and inhalation medication, Relenza.
There are so many people who are afraid of vaccinations, and they say, the vaccines get me sick. As a doctor, what do you say to such people?
No, definitely no. For example, the flu vaccine, the common one used, the injectable one, is a kill vaccine. So there's no live virus, so it can't give you the flu. Those people that complain of the flu may have had the virus in the few days preceding getting the shot. Okay, there is another vaccine which is a live attenuated vaccine which is reduced in terms of its ability to cause the flu. That's given by a nasal spray, and that can cause symptoms similar to the flu but not as severe as the flu. So there is some complication of flu symptoms with the nasal live attenuated vaccine, but not with the kill vaccine.
People go to the internet a lot to kind of treat themselves. The internet has become a doctor. What do you say to such people?
There's a lot of information there, but what I would suggest is that before they take any recommendations, they should consult their doctor first.
The doctor first, doctor last. And
Doctor
not
first.
doctor of last resort.
No. But there's a lot of information there, and most of the websites that I see, the credible ones, would advise you to speak with your doctor before you take recommendations. What's good for one person isn't good for the other person. You always have to keep that in mind.
What kind of lifestyle modifications are necessary at this time of the year?
Precautions. First thing, washing the hands is the most important thing that you can do. The flu virus can live on a surface up to 8 hours. So if a person has the flu, touches his or her nose or throat, and touches a surface, which is a table, a desk, a doorknob, pen or pencil, that virus can stay alive in the right conditions for up to 8 hours. Another person coming on, touching that same surface or item and touch the nose or mouth can transmit the virus. So washing the hands, keep your hands away from your mouth or the nose. Okay, avoid people around you who you know have the flu, or people who are coughing and sneezing. Stay at least 6 feet away.
And for people who may have the flu, but they don't want to tell you they have the flu, what do you say to such people? I've seen some people with wearing masks, but that's not something that you really want to.
Well, if you're conscious and care about the people around you, and you have the flu, stay home. Don't go to work. The best way to control the flu is those people who have it, stay at home.
The cold weather, this type of cold weather, is it really very, very dangerous in terms of allowing for easy transmission of the flu? Or it can happen through any type of weather?
It is. There is a myth that cold weather causes the flu, but cold weather doesn't cause the flu. It's what you do during the cold season there that causes the flu. When it gets cold, what we do, we stay indoors, we recycle air, we are close to each other, we cough and sneeze on each other. So we transmit the virus that way. It's not the cold itself. It's the fact of our behavior during the cool seasons of the year.
So we ought to be very careful in everything.
Be very careful.
Be mindful of the person around us.
Of course,
and other people who are around us.
That's right, yeah.
We've heard growing up that no man is an island.
That's right.
So be conscious and aware of all. Thank you very much, Dr. Hutchinson, for being on Brooklyn45. There are some questions about fevers that I want to ask you, but I'm going to invite you back.
Sure.
Because there's been a lot about measles, a lot about mumps. That's epidemic proportions. So we're going to invite you back to have a discussion about that.
I'll be happy to come back.
Okay. Thank you, Dr. Vincent Hutchinson. And now we go to Yolanda Watson.
We all know that knowledge is the key to everything. I hope that this affirmation will encourage you to apply what you know. Knowing and understanding is knowledge. Knowing, understanding, and applying what you know is knowledge at its absolute best. I want to hear from you. And if you have an affirmation that you would like us to share with our viewers right here on Brooklyn45, you can email it to me at info@brooklyn45.com, and we will gladly share with our viewers along with your name if you would like us to. We're also posted on our Facebook page and on yours if you want us to. I'm Yolanda Watson, and this is Brooklyn45. Moving on to Sharon Rose, who's with a young student who knows about the importance of knowledge.
Brooklyn45 with Professor Sam Taitt.
Thank you, Yolanda. There's a phrase that goes, knowledge is key, and our guest this evening seems to have that on lock. Kenya is a senior at Medgar Evers Prep, and she not only manages to keep a 92 average, but she also participates in community service and extracurricular activities. And she manages to do a wonderful job volunteering in her community. Good evening, Kenya. Welcome to Brooklyn45.
Thank you.
Okay, so tell us about some of the things that make you excel in school.
Well, the main thing that really makes me successful in school is learning how to sacrifice and learning to be extremely dedicated and focused. I had to realize that I had to become an independent thinker, and I couldn't really follow my friends and whatever they wanted to do. I had to realize that sometimes you have to give up the things that you would like to do for the things that will make you a better person. So that means cutting out hours of TV, cutting out hours of going on Facebook, to really put in those hours studying or just trying to become a better student. So.
Okay, so do you study a lot in your endeavor to be the best that you can be? Do you end up putting in a lot of time studying?
Yeah, that was one of the things that I had to learn and learn quick. I had to pick up really good study habits. I didn't used to study a lot when I was a freshman, but since I started taking college courses, the curriculum became really challenging, and the professors expected that you would read ahead and would actually know what the lecture would be about before you got to class.
Okay, so you mentioned college courses. I noticed in your transcript, yes, you're taking quite a few college level courses. Tell us about some of those courses and you know, what are your experiences with the courses?
So I'm on track to earn an associate's degree from Medgar Evers College, and I'll actually be graduating from college before I graduate high school. I've taken courses in maths and sciences, biology, chemistry, pre-calculus, calculus 1, calculus 2, English, histories, everything that a regular college student is expected to
So
take.
when you leave Medgar Evers Prep, you'll have an associate's degree? Is that what you're saying? Awesome, really, really awesome. Okay, and what are your favorite subjects?
My favorite subject is history right now.
Okay.
It used to be biology. I still love biology a lot, but I just find that history finds its way into our lives every day, and they always say history repeats itself, and I see it so often, so it's really interesting to me.
Cool. And we are making history every day, right?
Yeah.
Yes. Tell us about some of the academic and leadership opportunities that you've been involved in, that you've been privy to be a part of, like some of the awards and honors and so forth.
Well, my favorite leadership opportunity is under student government in my school. I'm the president of the SGO. It's been a really challenging experience. It's just been so much fun at the same time. You learn so much about how to deal with others. Another leadership role that I've assumed in my school is as the CEO of Project Green Up. So this year we're really trying to transform the community and the outside and inside of our school. We really want to promote pride in the community, healthy eating, healthy living, and energy conservation, everything. We're really trying to transform that.
Wow, sounds like your hands are full and you still find time to study, huh? And I understand you have other extracurricular activities like community service and sports and that kind of thing. Touch on a few of the things that you do.
Well, I ran track in high school. I had to take this season off to focus on school, but I'll be coming back for the outdoor season. Other community service activities that I've participated in is outside the school. I worked with a neighborhood organization named Erasmus Neighborhood Federation.
Okay.
And I volunteered at the summer camp, and I'm volunteering currently at a Zumba and exercise program on the weekends just to teach kids about healthy eating.
Okay, so what are your goals past, after you finish your education? What would you like to become as a career choice?
I want to be something in the medical field. I figured that if I didn't become something on the physical side of medicine, I would become something in the policy-making side.
Policy.
Healthcare is really important to
I see.
the people in our community. I mean, at some point in everyone's life, they become sick. So that's really where I want to take my life. I feel like I have a calling there, and I just want to be a change agent in that field.
Wonderful. Well, you can. I'll put myself in your hands any day. All right, because I'll be old when you're practicing your policy making. So then I'll trust that I'm in good hands. What are some of the parting words you have for young people your age to stay motivated and to encourage them?
I would just say be focused. Always see what's at the end of the road. Don't be discouraged by little obstacles. Just really be focused and learn to make those sacrifices that I had to make.
Okay, wonderful. Thank you so much for inspiring me and for inspiring other young people who may be watching the program. And we'll be happy to have you back again another time, even when you're practicing or when you're making some new policy for health in New York State or elsewhere. Thank you again for joining us on Brooklyn 45. I'm Sharon Rose.